Mi nombre es María Mendoza, nosotros somos pacientes de la clínica Ravensburg. Ella es Stacy, de 7 años, y Cristopher, de 10 años. Yo estoy muy contenta con la clínica y me gusta mucho la atención que dan y el servicio que dan. Entonces, para mí es la mejor clínica. Tanto para los niños como para mí y para mi esposo, desde que llega uno y se registra, muy amables, muy atentos. Y uno se siente en la confianza de preguntar algo que no entendemos, como algunos estudios, y nos van a decir, como para qué son los estudios. Sí, nos da mucha confianza la clínica. Lo que más me gusta, la atención que nos dan tanto las enfermeras como los doctores, muy amables, y se va uno sin ninguna duda, porque todo queda claro. El doctor David para mí se me ha hecho una persona muy buena gente, una gran bendición, porque yo desde el primer día que él atendió a los niños, yo me sentí confiada en saber que ellos estaban bien atendidos. Y a ellos les gusta el doctor Davis que los atienda.
Dr. Davis is my doctor. I see Dr. Davis as my friend. What I like most about my doctor is how he explains the things, like what are we getting, for example, a vaccine shot.
I like that he explains when I am sick. He explains what I have to my mom.
My name's Jeremiah Davis. I am a pediatrician. I'm also the Associate Medical Director for Pediatrics, and I work as the Electronic Health Record Provider Lead. So Cristopher is a fantastic patient, but he has had some medical needs throughout his life, and so here at Ravenswood we serve not only as his primary care home, meaning that we provide regular checkup visits for him once a year at his age, but we've also helped meet acute care needs. So Cristopher has asthma and also has allergies, and so we've worked with his family when he feels ill or when he feels sick to see if he needs additional treatment for those conditions. So we'll see them for acute visits or for same-day visits. And then on top of that, Cristopher's had some subspecialty care in his life in various groups at the Children's Hospital, and I really see our role as being a care team that can help his mom and help his family understand, why these visits are important, make sure they have those visits coming on a regular basis. If there's questions that the family has after seeing those specialists, we can help kind of translate that information for them. And if there are referrals or other things that they need related to specialty care, we can help the family stay on top of those. It can be really challenging to have a child who needs specialty care, and so navigating that world is confusing, and I think primary care medical homes and pediatricians in general really work hard to help families understand that process better and be there for them when perhaps something doesn't go well or something might be a little more complicated than they expected. I think my relationship with Cristopher and Stacy and their mom and the family in general is exactly that. I think being a scientific resource to them or being an advisor to them, their mom is very astute and she understands a lot of the things that both children need, and she is fantastic about coming in and following up and making sure they get refills for medicines or making sure they have upcoming appointments as necessary. But I think what I offer them is just a little bit more advocacy with the specialty teams for their kids, but also helping her understand sort of what our next steps are, what treatments options are, and then also helping the family just be aware of kind of what their ongoing needs are as they grow. So I really feel like in this situation for Chris and his family, not only have I been a resource for some of their subspecialty care needs, but also just for their primary care needs and making sure that we've got all those basic things done at the same time, which can be a lot of information. It can be confusing at times. I have to say, I am really impressed with the work our pediatric team does in general. I think we work very hard every day to provide a high level of quality care for patients. And then in addition to the medical care we give, we pay a lot of attention and put emphasis on watching out for factors that influence kids' medical care and their health. So thinking about things in their environment or things socially that might be impacting how healthy they can be. We try to focus on those, make families aware of those factors, and connect them or provide resources that enable them to improve those areas of their health as well, and not just their medical needs. In addition to that, I really think we do a great job focusing on individual patients who may have unique needs. There are many examples, but just within the last week, I've seen some really impressive above and beyond moments from our clinical team. Everything from having a patient who needed a particular kind of splint for an ankle injury and having a team member go through multiple supply closets and through the building to find the right one for that patient and come back and make sure it fit correctly, to resources where we have patients who come in and may need, hey, ran out of diapers and we really could just use an extra box or shipment or something, and trying to really track down any resources or things we have to offer and give them. It's those kind of moments where we meet the medical need, yes, but at the same time, what's really concerning to the family may be something is slightly different than just a drug or a treatment, and we try to catch that and try to focus on that and try to make sure they feel like we're taking care of them as a whole and not just paying attention to their vaccines or their vital signs.
Pues sí, a mí solamente me gustaría como decir de que la clínica yo la recomendaría. La recomendaría porque es una gran bendición tener la clínica Cristopher, y yo pienso que para nuestra familia es una buena clínica. Mucha ayuda nos dan y nos brindan.
We know that health is really the foundation for a lot of future success for children and for families. And so my hope is that by providing a place that's open to all to come and have their healthcare needs addressed and have their health in general addressed, that we're enabling them to go forward and attend school, go forward and participate in work, go forward and head to college, be able to pursue whatever dreams they have, because without health, it's really difficult to maintain that kind of focus and that kind of attention. When you're healthy, you're able to seek out more opportunities and successfully accomplish those things. So I really see our role here as not solely to meet the need in the moment, day by day or week by week, but also to really set patients and children up especially for a foundation of success in the future by allowing them to remain healthy and know what it takes to do that, and then to seek out opportunities in the future that they can pursue and have success.